What's up, guys? So I had to have rotator cuff repair surgery on the 21st of August, which was yesterday. And the staff was nice. Had a good time with them. They were joking and having a great time early in the morning, which is always good when you have a staff that can be that cheerful early in the morning. I had to be there by 6:10 at the surgery center. They checked me in. I got some vitals, paperwork done. Then I had to get a nerve blocker put in on my neck that would numb this entire arm. They took me in. Surgery went well. I came out not feeling anything. So for the first 12 to 24 hours, you cannot feel anything. For the first 12, I couldn't even, lift my fingers or anything. It was just completely numb and dead. But I will tell you, around that, a little after 12 hours, I'd say my surgery was about 7:30 yesterday, and about midnight, that pain kicked in. And when I tell you it kicked in, it was hurting from my shoulder all the way down to my fingers. I mean, I won't say it's the worst pain I've had because I've had 3 kids, but it was intolerable. And the medication I was given was 5 milligrams of oxycodone. That didn't do anything. Now, I did not wait until the pain kicked in to take the medicine, which is what they told me not to do, and so I followed that instruction. But that pain still came through like a freight train. So I took 3 doses of it because it's every 4 hours. Didn't do anything. So I was in so much pain by 4 something in the morning. I said, let me switch over to ibuprofen. Now, I'm not supposed to take ibuprofen because of a prior surgery I had, but that pain was whooping my butt. I took the ibuprofen, 600 milligrams. It is prescribed. And after about 30 minutes, that did the trick. I was able to sleep and rest a whole lot better after that. I got up this morning, took it again. Still working well. So I would say for this surgery, you definitely need support around you. You want to make sure you have your stool softeners, get all of your food ahead of time that you need, stuff that's already prepared if possible. I did that, fixed my sandwiches and everything, so I just have to grab and go. Juice some water in the refrigerator, just grab and go. I also got a after surgery bed support memory foam that would have me sitting almost upright because it's hard to lay flat once you've had the surgery. That was about $60 on Amazon. I'll figure out how I can insert it somewhere. Also, it helps to be mindful of your surroundings because I have hit the shoulder or the sling a few times and that hurts. But while I was tossing and turning, my kitty cat had no problems sleeping, which was wild. Now, when it comes to this surgery, everybody's going to be a little different. Depends on what they had to do once they got in there. But with my rotator cuff surgery, they're having me start movement the second day. Now, some things I did not know before the surgery is once you have the surgery, you cannot shower for 3 days. I think it's 3, but let me read to you what my instructions was, because everybody's instructions are going to be a little different according to what you're having done and how severe it was. But these are just mine and what I have to follow. It says what to expect activity. It is normal to have discomfort in your shoulder for several days. For the first 2 or 3 days post-op, use ice packs on your shoulder to help reduce swelling and pain. Ice for 1 hour every hour by giving 30-minute breaks in between while awake. Do not place the ice packs directly on your skin. Use a barrier in between. For the first 2 to 3 days post-op, sleeping in an upright position will help reduce swelling. Support your operative extremity by placing a pillow underneath your elbow when sitting to help reduce pressure on your shoulder. That does help. Do not drive until cleared by your surgeon. Don't have to worry about that, because when you hit this sling on something, your shoulder hurts. Your weight-bearing status is non-weight bearing to your operative arm. Wear your sling at all times, except for bathing, changing, or your pendulum exercises. We encourage finger, wrist, and elbow range of motion. Dressing, wound, and bathing care. Keep your dressing on, clean, and dry until post-op day 2, Sunday. That's me. I'll be on day 2 tomorrow. Today I'm day 1. So today I started my pendulum exercises this morning because they wanted you to do the range of motion, wrist, and elbow as well. So day 2, Sunday, tomorrow, I may remove my dressing, place band-aids over the surgical sites, change band-aids daily and as needed. If you have steri strips, do not remove them. They will fall off on their own. Post-op day 3, which is Monday, which is what I was talking about before, it says you can shower. Do not scrub, simply pat dry the operative area. Place band-aids over the surgical sites. Change band-aids daily and as needed. Do not place any ointments or lotion powders on your surgical site. Do not bathe, swim, or submerge yourself into water until cleared by your physician. So those are my instructions that I'm following to a T, because I don't want anything to go wrong. I have been doing my exercises, so I will have to show them later when I take this off how those go. But as of right now, I'm taking it easy, and I will let you know the surgery is painful. It's painful. Especially if the medication they give you does not work as they should, which mine didn't. So I had to change what I was taking. So I will keep you posted as to what's going on. I'll do my little shorts as well, because I don't want to have the videos too long. But I will update you a little later on how things are going.